The City of Toronto has done a great job supporting the Black community groups, but I think we need to have a combined effort with the province and the federal government.
The Toronto Black Scientists Task Force on Vaccine Equity and several Black organizations are raising concerns about vaccine hesitancy and people in the community delaying to get their second shots.
At the height of the pandemic, like last year in June, 33% of the infections in the GTA were in the Black community, and we only represent 9% of the population here. So although now that number has dropped to about 12% and 13%, we're concerned that with this low vaccination rate and the emergence of variants like Delta, we're concerned that we're going to get back to a situation where the Black community has a high representation of infections and hospitalizations and unfortunately deaths.
Those startling stats are why groups like the Jamaican Canadian Association have been doing their best to educate the community, but leaders understand the challenges that arise because of mistrust due to systemic racism within the healthcare system, among other issues.
I think there's also, the massive social media. I'd call it a campaign where people are hearing very mixed messages. And then there's this wait and see attitude as well. Let's see how it plays out.
In February, the Toronto Black Scientists Task Force held weekly town halls to educate the community, which they say were well attended. However, they say attendance has dropped significantly in recent months, which is why they are renewing calls to make sure this important message is getting out to a vulnerable segment of the community.
More than 50% have had one dose of vaccine, but we're concerned about complacency, and we know that not only can government, but our community leaders, our faith leaders, individuals who run sporting events and concerts, those venues could be used to really promote vaccination when you've got so many people together.
I think the conversations, and we have seen through our clinics that the conversations matter. Those one-on-one interactions where people get to ask questions, where they don't feel, like embarrassed about the questions that they're asking, where they can get specific information, has also been really impactful.
The Toronto Black Scientists Task Force on Vaccine Equity also says two issues affecting the health of Black workers in the pandemic are limited access to paid sick days and the inability to work from home. In Toronto, I'm Rowe for City News.